Thank you, Madam Chair. The issue of drug pricing is a critical issue that Americans across the country and across the ideological spectrum want us to address. Kaiser Family Foundation's polling for the last midterm found that 71% of Americans viewed health care as a very important issue to them, the highest of any category. When asked why they view health care as a very important issue to them, the most common answer was cost. Prices have been rising in just about every aspect of our healthcare system, but a big driver has been the cost of prescription drugs. As a pharmacist, I know firsthand how out-of-control prices can hurt patients. This should be a bipartisan, all-hands-on-deck effort, and I think this bill is a great bipartisan, common-sense starting point. The Medicare Payment Advisory Commission, or MedPAC, and the Medicaid and CHIP Payment and Access Commission, or MACPAC, were established to give Congress recommendations on how we could improve the healthcare system. If they are going to be making recommendations, we need to make sure they have the data they need to make those recommendations as informed as possible. Last year, both MedPAC and MACPAC wrote to this committee asking for access to drug pricing and rebate data that technicalities in statute were preventing them from receiving from CMS. While this data is confidential in nature, these commissions are built to handle healthcare data like this and use that data to inform their work. This bill would finally allow both MedPAC and MACPAC to have the data they need to provide us with informed recommendations. These recommendations will only help to guide us in the important task at hand, lowering prescription drug prices for Americans across the country. I'm glad to be joined by a great bipartisan group of members co-sponsoring this bill with me. Representatives O'Halloran, Welch, Giaforte, Tom Rice, and Jimmy Panetta in Ways and Means. This is a great first step to what I hope is a robust bipartisan effort to take on drug pricing. Madam Chair, I'd also like to submit these two letters from MedPAC and MACPAC addressed to the committee requesting access to this data for the record, and I ask for unanimous consent.
So ordered.
With that, I'd like to thank the chair and yield back my time. Yes, I will yield.
Thank you, John.